Thank you, Dr. Juan. I'm very grateful to be here. I'm very grateful to you and Abuzer to organizing this session and for keeping the society alive. So I'm going to talk to you this morning. Now here in Brazil is very early in the morning, but I know that we have people from all over the world here. And you are more than welcome to ask questions in the Q&A portion. And if I don't have time to answer during after the presentation, I can type the answer. So I'm going to share with you the microsurgical anatomy of the central core. First things first, let's start with the definition of this area. Okay, what is the central core? And for that, I highly recommend this article by Dr. Ribas, a dear friend, and he wrote this definition that I'm going to show you. So the central core stands as a block on the it gets the surface of the insula, as you can see here, and then the string capsule, the claustrum, the sternal capsule, the putamen, the globus pallidus, externus and internus, the internal capsule, so the anterior limb and then posterior limb of the internal capsule, the caudate nucleus, the stria terminalis and the thalamus, okay, and also a portion of the septal region. But also we have this area right superior and posterior to the anterior perforate substance, and we have also a portion of the accumbens, of the nucleus accumbens, substantia innominata, and also the medial portion of the anterior commissure. Okay, is also a part of the central core. So now that we know the definition, it's very important to understand how these areas are connected to the brain, and also some connections between them. So here in this lateral view, I've removed a portion of the frontal lobe. We can see the right side, and we are going deeper, and these deep structures, they are still connected to the left side. So in here you can see that the putamen is continuing here with the substantia innominata, okay, and then you have here putamen and substantia innominata. We don't have a clear separation between them. And also we have here the caudate nucleus continuing with the accumbens. Okay, and here in this anterior view, we have here accumbens continuing with the caudate nucleus, and laterally we have the substantia innominata continuing with the putamen. I don't know if you can see here, but a portion of the anterior limb of the internal capsule, we can see separating the substantia innominata and accumbens, and also caudate nucleus and putamen. It's not, we don't have so many fibers here in the basal portion, but you can still see these fibers, and they are very important fibers when we are thinking, because here we are in the session talking about complex surgeries, and my field is functional neurosurgery. So these fibers, they are very important when we are treating obsessive compulsive disorders, OCD. So we are stimulating the posterior portion of these fibers, right anterior to the anterior commissure, and also portion of the accumbens. Okay, so let's go deeper from the surface and understand where exactly is the central core layer by layer. And this dissection was performed by Seha Baidin, Dr. Seha Baidin. I've been working with him and Dr. Abuzer Gungor in these dissections, but this one he performed. And then I'm going, it's the next 5 slides as well, okay? So here in this lateral view, we have the surface of the insula, as I showed you from that superior view before. And then once we remove those cortical portion of the insula, we have the stream capsule, okay? And then these areas, well, once we remove this stream capsule, we have the claustrum, and also we have the external capsule, okay? And then when we go deeply, we have the putamen here, okay? And then this ventral portion of the stream capsule is formed by the uncinate fasciculus ventrally, and also the inferior occipital fasciculus dorsally. And then when we go deeper, we have GPE, or globus pallidus externus, and also we can see these deep arteries. And I really like this dissection. Dr. Seha did a great dissection here. So here we have the lenticular-striates arteries, all right? So, and you can see all these dissections in this article that I really recommend you to read to understand better this neuroanatomy. So now I want to invite you to a deep understanding of some of the deep structures of the central core, because once we, and last night, Dr. Carolina Martins was talking about that when she was presenting at the Dr. Evandro's legacy and also master in neurosurgery. She was talking about the mindset that we have. And all of us, former fellows of Dr. Rhoton, he was always teaching us to keep working, and also to every day to perform better than what we did on the day before. So that's why I went to the lab. That's why I tried to learn even more about these structures, mainly the globus pallidus and also the thalamus, okay? I also studied other structures, but because here we are talking about the central core, I want to get to go deeper in these structures, okay? So, and these structures are also important for tumor surgeries, okay? We have many surgeries that we need. We just had a question about the insular tumors. So it's very important to understand deeper this neuroanatomy, so we can even understand and even answer the question that we just had, to understand what is going to happen to the patient once we get to that structure, that we move that portion of the brain. Okay, so first the GPI, the globus pallidus internus. Here we have anterior view, and then we have for you to localize, you have to be, you can see here the optic tract, both sides, okay, and then right superior to the optic tract, we have GPI here, both sides. And you can still see some of the structures here that I showed you in the lateral view, and also anterior. You can see here accumbens, and laterally substantia nominata continua with the putamen. Okay, here portion of the surface of the insula. here also the surface of the insula, and then you can see you can have a better 3D understanding, that X-ray view that Dr. Rhoton used to say, to understand better these deep structures. And here in this lateral view, you can see the optic tract, and right superior to the optic tract, and the optic tract in the functional neurosurgery field, and of course in many surgeries that we need to work with the globus pallidus, it's a very important landmark in surgery. So mainly in functional neurosurgery, we can even hear the firing when we are using the MER. We can hear the firing of the neurons in this area once we get closer to this tract, and then we can know that we are in the correct position to implant the lead. Okay, and here inferiorly we have the subthalamic nucleus and substantia nigra here, and then here in this inferior view we have GPI, both sides here, and you can see a very quite clear connection here between the GPI and the STN. I'm going to show you a little bit more about the connections. And you also can see how important it is to really see the structure, mainly in functional neurosurgery. I mean, in all the surgeries that we are going for, we need to what we're going through step by step, even before surgery. And then here we have GPI and GPE it's a special sequence in MRI that we call F-gator. It was this sequence was made in Gainesville, okay, where Dr. Rhoton's lab was, and then it's very important to see, and that's why they call F-gator. It's called F-gator because of the gators that they have there, the football team in Gainesville. Okay, so and then we can see very clear here the lamina between the GPI and the GPE. So, and here we have these connections. Okay, we have the thalamus, the connection, and these are beautiful drawings made by Robin, dear Robin. And then here we have the connections between the GPI with the STN, and also the thalamus, substantia nigra, PPN, and GPE, and STN, and amygdala, and putamen. Okay, we could have one meeting just to talk about these structures and these connections, but then you can start to see maybe why it's called the central core, because it's these, and I'm just showing you here the GPI, but you can understand that even the thalamus that I'm going to show you later, it's connected to many areas of the brain. Okay, and I'm just showing you here what I got to dissect. I'm also going to show you more detail. So, and here I really recommend you to read this article also that I was honored. It was just published last month. I was honored to work with Dr. Eric Middlebrooks. That he's a neuroradiologist now working at Mayo Clinic, but he used to work with Dr. Rhoton. We all had Dr. Abuzer Gungo also worked with him, and he performed his, right now, as Dr. Arkin was saying, we have, the neuroimage is evolving, and with that we're getting to see better the tracts. And here is a 7 Tesla MRI, and we can see the connections between the GPI and the STN here. Okay, and also the fibers, the connection between the GPI and the thalamus. Okay, so 2 structures there in the central core, they are connected. And these connections here, these red, yellow connections here, they are the pallidothalamic. They are portion of the temporal portion of the fibers. And these are fibers that we are stimulating when we put a lead here in the VIM, the anterior portion of the VIM, so we can get better the tremor for the patients, for example. And also these fibers that I'm going to show you later that are coming from the dentate dentate nucleus in the cerebellum. So the nucleus that Dr. Akin just showed you, it's connected to the thalamus, okay? So, and then let's just go step by step to see what we have when we have this lead in the brain. This was my main work at the Dr. Rhoton's lab. And we cross the superior frontal gyrus and then U fibers. And then we are going deeper, and then we have corona radiata, and then putamen, and then GPE, GPI, and the optic tract deep there, okay? So, and then I mentioned that we have those connections to GPI. So, and why is that important? What is that helping us in the surgeries? So we performed also this work, and we did a segmentation of the globus pallidus, and we got the patients. We used the UPDRS, that is the scale that we use to measure how the patient got better. And we have all these areas, all these structures connected to the GPI. And you can see how this structure in the central core is important for it's connected in the brain. So, and the patients who got better, got a better improvement in the UPDRS was the patients who had the lead into the supplementary motor area and premotor cortex, okay? And you can see many of these dissections that I showed you in this paper that just came out in neurosurgery in June this year. That it's my my main work over there with, at the Dr. Rhoton's lab, and also Dr. Abuzer Gunger is here. He helped a lot in this work. So, and for the thalamus, just some points. And when we go deeper in the thalamus, we can see many nucleus, important nucleus. And we have VIM that we use when we are stimulating for tremor. Here we have the complex, the centromedian parafascicular complex that we stimulate for Tourette's, epilepsy. And here, those connections that I mentioned. Here we have dentate nucleus, both sides, the cerebellum that Dr. Akin just showed. And then we have the fibers going up here, the dentato-rubrothalamic, that is here, the nucleohubrus. And then we have the red nucleus. And then we have going superiorly, we have VIM both sides, okay? And here we also have this is also, it's also in that paper that just came out last month. And then we have here the fibers. Some of them, they are going to go, coming from the dentate nucleus. They are going to cross, and some of them, they are going to come from the same hemisphere, okay? And in this medial view, we have the medial lemniscus coming up, and here we have VC, that's the ventral caudalis in the thalamus. So it's very important, a very important landmark, and it's related to sensory. And again, the complex. And we perform the same thing for the essential tremor patients. And we also discovered that they had the TRS scale. It's the tremor rating scale. They got 75% better when we got to stimulate the supplementary motor area and also the premotor cortex in those patients, okay? I highly recommend this book that just came out last month. It's a deep brain stimulation book with Dr. Michael Ockham. That's the head of neurology at the University of Florida. And I was very honored to have one of the pictures that I just showed you here in the cover. Okay, so I want to thank all of you that is here. Like seeing, I would love to be in person, but at least we can see each other and still have a connection and keep this Rhoton Society alive. It's kind of continuation of this last day here in the lab. Okay, so it was a very sad, it was June 23rd in 2017, and here with Robin, Alice, and Laura. So I'm very grateful to all of them, and I'm very grateful to all of you for keeping this society alive. And here's my team. I'm very grateful to Dr. Evandro, who invited me to help in the lab, to coordinate the lab with Dr. Mateus. And he is in one of our courses in the lab. And we still have fellows coming. And even now, during the pandemic time, we have 3 fellows here from Libya, from Cuba, and working and keep working in this field and keeping what Dr. Rhoton told us, because he was always saying, I want you to be teachers, and that's what we are doing here. We are sharing what we learned from him and what we are still learning. Yes, towards the fellows, working hard, and we promise to do that for the rest of our lives. Okay, so I'm with that. I want to finish. Thank you.
Thanks, Vanessa. Thanks so much for your lecture. Really enjoyed. Those are amazing, beautiful pictures and dissections.
Thank you.
So intricate to understand that central core. And we might see some study from Ur later on the central core. Let's see. Beautiful.